Hi everyone, thank you again for attending our session today on the effective food allergen management for businesses and consumers. We hope that you find this session interesting and beneficial to your work and for your interest in food allergen. So I'm Amy, the Regional Marketing Manager for Roma Lab Singapore, and we are very pleased to have our guest speakers for today. From very respected areas in Australia and New Zealand. So going through the agenda for today, we will first be introducing on PEAL, the regulations and recent developments around this regulation. And we have invited Mr. Glenn Neal, who is the General Manager of Fazens, to speak. And then the second topic will be on the impacts of non-compliant product labeling. And Mr. Alan Edwards will be taking this topic and sharing with you all insights around this much discussed topic, especially for food exporters in the region. And then we have invited Ms. Ingrid Ariel to speak about allergen management in practice. Ms. Ariel is from Nestlé and she's the Oceania Food Safety Manager. And I think she will be giving you a good insight on how this allergen management is practiced in a food manufacturing setting. Lastly, we have invited Ms. Yongwei Liao, the Managing Director for Roma Labs Asia Pacific, to speak about the solutions and developments in testing methods for food allergens. So without further ado, we would be inviting Mr. Glenn Neal to speak on the first topic. Let me give you a brief introduction of Mr. Glenn Neal. Glenn is responsible for the risk management and intelligence functions associated with developing food standards at Fazens. Glenn's background is in public health. He has held a range of leadership positions within New Zealand's central government, food and biosecurity authorities, such as the Ministry for Primary Industries, and have managed the establishment of Fazens. So without further ado, let us invite Glenn. Yep, Glenn, please.
Okay, here we go, presentation. Ngā mihi nui kia koutou, namaste, Nissan Bula Vinaka, and to our Malaysian and Indonesian friends, salam, Xin Chao to our Vietnamese colleagues, Ni hao, of course, to our Chinese colleagues, Kumusta to our Philippines colleagues. Hopefully you can see my screen. Amy, you got that okay? Very warm welcome to you all. Hi, I'm Glenn Neal, General Manager at Food Standards Australia and New Zealand. It's a great pleasure to be with you today. Listen, I wanted to talk to you first of all a number of aspects relating to allergen management. Last year in Australia, 2020, was our biggest record year for food recalls. We had 103 in Australia, 47 of which were due to the presence of undeclared allergens. So about half of all food recalls in this part of the world last year were due to undeclared allergens, and I know the numbers are very similar for New Zealand as well. By way of how did that problem get detected? So this graph shows how the problems came to surface, how they were discovered, and a good third of them, the green portion there, are due to customer complaints, which also yielded some sort of government investigation or government testing. So about 2/3 of the problems are occurring not because of appropriate management or extra testing by companies, as is sometimes thought to be the case, but we're talking about 36 instances where customers had some sort of a reaction or some sort of a detection of the problem. So the problem is getting bigger, and we feel it warrants attention by those in the food industry. So welcome today, and I hope you are now paying attention as a result of the size of the problem. I want to highlight the work of the World Health Organization and the Food and Agriculture Organization, in particular their bodies codex that are both there are two committees that are working on allergy management at the global level. And in May of this year, an expert consultation from WHO/FAO released its first report and provided a revised list of the global priority allergens. And work is now underway on the thresholds associated with each of those allergens. That work is being undertaken as an expert advisory to the Codex Committee on Food Labelling, or CCFL, and in particular, the work that Australia is leading on behalf of all Codex members to actually review the general standard for the labelling of packaged foods. CCFL, at its 45th session in May 2019, agreed to some more work, and I believe is meeting in October of this year to progress that work. It established an electronic working group, which we chair, as I say, and that sought aspects of scientific advice in conjunction with another Codex committee, the Committee on Food Hygiene, CCFH. So they recently completed a code of practice on allergen management, and that's a very useful guide for the food industry globally. As I say, the next step is CCFL later on next month, in fact, to progress their work to step 3 of 8. So possibly about 3 to 5 years away from revising that general standard for the labelling of prepackaged foods. In order to underpin this work, both FSANZ and the Food Standards Agency of the UK, well, actually it's not of the UK anymore, it's the Food Standards Agency of England, Wales and Northern Ireland, we joined forces to complete a review of the literature into consumer responses to allergen labelling. And in particular, found that repetition and consistency is very important to assist consumers. And this is quite relevant in an era of an increasingly globalized food supply. Consistency, not only of the terminology, but also its location, was found to be really important in the studies that were examined. And various approaches to highlighting allergens are also very useful, such as bolding, using a large font size, and the use of contrast. This literature review, which is published, by the way, on both FSANZ and Food Standards Agency websites, it recommended the use of plain English language labelling, avoiding scientific terminology, and particularly noted that terms for milk and egg can be particularly problematic for consumers. Research questions around precautionary allergen labelling, PEAL, were what is the consumer understanding of PEAL? These may contain type statements. That's what we mean by PEAL. How do consumers use those statements? How does it affect consumer behaviour? What are the current issues with PEAL for consumers? So some very good questions that this research has looked at. And the findings: consumers view PEAL as unhelpful and confusing, and that it ultimately restricts rather than enables safe food choices. So attention to and avoidance of products carrying precautionary labelling statements may differ between those affected to a greater or lesser extent by a food allergy. Certain forms of precautionary labelling were less likely to be ignored by food allergic consumers than others. And this is despite there being no directive for PEAL phrasing to correspond to different levels of risk. Food allergic consumers supported heightened oversight of PEAL usage. They're basically struggling with it. So the next steps, that report has been shared with the Codex Committee for Food Labelling, for that electronic working group that I just mentioned. That this work will inform their considerations of allergen labelling and bring social science evidence into Codex food labelling for the first time. Very much this evidence is already informing management of allergens in the UK, Australia and New Zealand. And as I say, that report can be published, is published and can be found on the foodstandards.gov.au website. If you go to that to our main page and perhaps search PEAL, you will find more information there. So we've had a significant change to labelling requirements in this part of the world. The Australia-New Zealand Food Standards Code has been updated quite significantly in terms of allergen labelling. So I just want to highlight very briefly, those changes which are now set in legislation, and businesses have until February 2024 to implement those changes. And essentially, the differences are key. They're all about the location. allergen declaration statement is going to be needed, and they're going to need to be bolded in the ingredients lists. So we're requiring that that call out, that highlighting feature that the research told us was important. A big change also is the addition of a summary statement that summarizes the allergens in food, starting with this contain statement. So that summary statement must be next to the statement of ingredients and in the same field of view, but it must be distinctly separated. It can be above, can be below, can be to the side of, but it must be in the same field of view as the ingredients list. Significant change there. There's been a raft of changes also to, apart from those two key changes, there's been a number of other changes to the more technical aspects of the labelling of allergens, and in particular the old form of tree nut declaration has been expanded to be more useful to consumers, and specifically we're going to require now the naming of the specific nut that's involved, and Brazil nut, cashew nut, etc. So those are the 9 new versions of what was previously labelled as a tree nut, and the generic ingredient name nut will not be permitted from February 2024. So there's lots of information on PEAL, and I'm sure my good friend Alan Edwards at the New South Wales Food Authority will be going into some of that detail. I wanted to talk to you about how we, in this part of the world, in particular Australia and New Zealand, how we manage the development of regulation to make sure that it both meets the needs of consumers, but also takes into account industry considerations. And we have in this part of the world something we call an allergen collaboration. It's the only time that FSANZ brings together governments from the states and territories in Australia, both Australia and New Zealand government, together with food industry personnel, but most importantly, I think, our consumer support organisations. In New Zealand, it's called Allergy New Zealand, and in Australia, it's called Allergy and Anaphylaxis Australia. So 2 to 3 times per year, a group of about 50 of us representing a whole range of organisations get together, and we talk about developments in the literature, we talk about scientific advances, we talk about responses to certain incidents, we talk about, importantly, we talk about the resources that we're all developing so that we can combine our resources where possible and ensure that we don't duplicate or leave gaps in terms of particular food sectors that may need additional resources to help convey an understanding of allergen management. The most important part or product of this collaboration is something we call the Allergen Portal, and this Allergen Portal can be sourced from, again, from our website. The address is there below. If you Google Allergen Portal Australia, New Zealand, you should be able to find it as well. But in that portal, it really is the go-to place, all the information you need to know about allergen management, irrespective of whether you're a health professional from the food service industry or whether you're an interested consumer or one of these other groups. So we recommend that you get your information from the best place, and in the case of Australia and New Zealand, we think the best place is the Allergen Portal. I just wanted to finish by covering some real watch outs that I've picked up in my experience, and particularly with regard to importers and exporters. So food, irrespective of where it's produced, food for sale in Australia and New Zealand quite simply must comply with the Food Standards Code. And a key test there of whether or not imported food complies with the Food Standards Code is often whether or not it's labelled in English. That is a requirement, irrespective of who you're selling to in Australia or New Zealand. You might be a specialty retailer, perhaps only dealing with particular ethnic groups, but the Australian New Zealand Food Standards Code certainly requires information to be in English. We'd suggest that importers and exporters are particularly wary of claims that might be permitted in other countries under other legislation. Both FSANZ, regulators such as the New South Wales Food Authority, and in particular the Commerce Commission here in New Zealand and the Australian competition lawmakers have paid particular attention to free from claims. And so that's a certain word of caution that I'm sounding there. If you are have a permitted claim in a particular legislated jurisdiction, it may not be permitted in this part of the world. Recent surveys, particularly those conducted by universities, etc., indicate a high incidence of non-compliance with allergen labelling. So I've seen surveys of imported foods which indicate as much as 40% of imported food does not comply with allergen labelling requirements. And from there, that non-compliance is just one consumer incident away from prompting a recall. And I know that a recall can be very serious and in fact quite disastrous for some food businesses. So yeah, welcome along to today's webinar. We certainly hope that you're paying attention to the new rules and requirements for sale of food in this part of the world. If you're exporting to the US as of 1 January 2023, so you've got a little bit of time, sesame is now a priority allergen, so that change has recently been made. So a bit of a watch out there for those companies that are exporting to the US. And going back to claims such as milk-free. Now these are really appealing, obviously, to milk allergy consumers. And where you make a milk-free requirement, the actual specific levels of evidence required vary from country to country. It's generally a requirement when making any claim that to ensure that any such claims are substantiated, firstly through good manufacturing practice and good HACCP programs, which ensure controls are in place, verified and validated as being effective. But certainly if you're making a milk-free claim, for example, we've come across some instances where milk-free claims are supported with casein testing. Well, casein is just one of two proteins that are in milk. Of course, another is whey protein. So if you are testing, if you are making a milk-free claim, or indeed don't have milk listed as an allergen, then certainly casein testing needs to be supported with whey protein. So that's enough for me. Certainly for further information on PEAL, there's lots of it about. You'll hear lots more about it today. But on our website, we have lots of other information about PEAL. I know that the Australian Food and Grocery Council and its New Zealand equivalent, the Allergen Bureau, all provide really good industry guidance. The National Allergy Strategy similarly provides good information for consumers and for food service, restaurant businesses, etc. And those two consumer support organisations that I mentioned, Allergy and Anaphylaxis Australia and Allergy New Zealand, also provide excellent sources of consumer information. You can also keep in touch with us and monitor any developments via Facebook by subscribing to various pages on our website, or indeed following us on LinkedIn or via Twitter. Thanks very much. I'm happy to stick around and take any further questions later on. Thanks for listening.
Thank you very much, Glenn. For the next presenter, we would have Mr. Alan Edwards. So let me give you a brief bio of Mr. Alan Edwards. Alan is the Senior Food Incident Response and Complaints Coordinator with the New South Wales Department of Primary Industries, which is Australia's only through-chain food safety agency with regulatory responsibility from farm to fork. Alan has been involved in food incident investigations for over 14 years. Alan has a special interest in allergen management and has led many investigations in the allergen space. Alan has also worked as a teacher and a lawyer and has over 20 years of experience in investigation and prosecution work. So Alan, please.
Thank you. Just want to check, can you see my screen clearly?
We can see, but you might need to put it in full screen mode.
Yep.
Yeah, perfect. Thanks.
Thank you. So thank you very much for inviting me to speak at this the allergen management webinar. So a little bit of background. So the people that I work with is an organisation that investigates complaints or incidents relating to undeclared allergens, not just non-compliance, but as Glenn pointed out, non-compliance is is identified in a number of ways, by industry, sometimes by consumer complaints. So we often have to investigate situations where people are admitted to hospital with severe anaphylaxis, and it certainly isn't pleasant. So the backbone to these regulations, there's a really good purpose for them. So just looking, first of all, at what I'm going to talk about today is just some product recalls, or why you end up getting a product recall due to undeclared or incorrectly declared allergens, actions taken by the regulator in those instances, and economic impacts to business. So just looking at the boring bits first, because there's always a legislative background, and Glenn talked about the code. They're the provisions in the code that apply in Australia in relation to declaring allergens. It is important to remember that some people are also allergic to ingredients that may not need to be declared as allergens. So for example, celery. So it is equally important to ensure that the ingredient list of the product is accurate, as well as the allergen statement of the product. So just by way of background, the first two slides are a summary of the legal obligations. And I'm going to send a link to some guidance documents. Some of them Glenn already talked about, but I'll send you a link to their actual, the site where you can obtain those. They're very good in providing advice on where to put and how to present information. So that's the FSANZ requirements. There's also other requirements in Australia that relate to what's called model food provisions. And these are basically every state and territory in Australia has agreed to apply the same laws. And these laws require businesses not to falsely describe food. Now, you might not think that not getting the allergen information accurate is a false description, but it is if, as the supplier of that food, you ought reasonably have known that anyone that consumes that food would have suffered physical harm if they did it relying on the information on the label. So it is important to remember that you have an obligation as the supplier of a food to ensure it's correctly labelled. And as the regulator certainly in New South Wales, and we work with other regulators across Australia, there is a process of following up with incidents that result in injury. And of course, a product recall, the whole recall process was established by industry as a way of managing risk to ensure that they could protect consumers when there was a failure with production for some reason. And it makes sense. So there's a positive side to recalls as well as a negative side to recalls. So that's the legislative background. Let's look at some case studies just to give you some examples of what we've found when investigating these types of instances. So in terms of common issues, we found that businesses that have a good system in place and really manage their ingredients, manage their labeling, manage their production, are really reliable in being able to get things right. And sure, they have problems occasionally, but they're producing food generally, and those problems are scarce and they're well managed. So where we find issues is where businesses have not recognised all allergens. So for example, they might say, look, we think peanuts are going to make people have a severe allergic reaction, but we really don't think that sesame is going to have the same effect, or Brazil nuts. So there's a misunderstanding amongst some people that some allergens are worse than others. In reality, a person that is at risk of anaphylaxis is at risk from that allergen, whether it is dairy, pecans, other forms of tree nuts, peanuts, whatever. So it's important to take the declaration of all allergens equally serious. There's also a failure we've noticed to distinguish between dietary preference and allergen risk. So for example, and I might leave that one, I've got a slide to demonstrate that later, so I'll leave that there and I'll get back to that. There's also a failure to identify specific ingredients. We've had recalls because, and Glenn mentioned casein. There was a whole lot of recalls in Australia in around 2017-18 due to businesses not identifying the fact that casein as a processing aid or an additive was not was actually dairy, and they were not declaring that as dairy on the allergen label. And in fact, in some cases, they were saying dairy free and putting that allergen in the product. And it did lead to significant issues for people. There were consumers admitted to hospital, to emergency wards because of that. There's also other issues where businesses have these fantastic systems, really well documented systems, but they don't actually check that those systems are being followed through the supply chain. And then, of course, there's the situation where there's a failure to verify. So you might get someone supplying you an ingredient or a food to sell, and they're making statements about that food, but there's nothing really to justify that statement. And there's been no testing or verification of it through analysis of supply chains. So let's look at a couple of examples. A process failure. This is based on a true example, and you might look at this and think, how could this ever happen? So it was a business that was producing a product and there were multiple failures. There was no checks that the correct ingredient was being added to the product. A second check of that had not happened, and the finished product check was missed. So what happened? At the end of the day, the product went out with the incorrect ingredient, and the manufacturer of that product looked back at what happened and said to themselves, we could have stopped this very cheaply, very quickly by having a good system in place, and they just didn't have it. This is the preference example I was talking about. Again, it's based on a real example. You've got a product labeled a vegan bar. In very large, bold statements on the back of the product, it states contains peanuts and soy. Near that, under the nip, there's a very small statement regarding made in a factory. Now, this is extremely confusing, and in reality, a consumer who has a dairy allergen purchased this product assuming that as a vegan bar, and incorrectly, by the way, assuming that it was because it was a vegan bar, it would not have traces of dairy in it. And what happened as a result of that? That person suffered a severe reaction. The product ended up having to be recalled, and there was a fine issued to the supplier of that product, all based on the fact that the labeling was misleading, and that goes back to that offence that I mentioned at the beginning of the slides. So another example of failures is a verification failure, where an allergen is introduced but not picked up. And you would have noticed a whole lot of pesto recalls in Australia linked to supply issues, peanut contamination of cashews that arose out of Europe. So there were problems with that, and a lot of those problems couldn't be prevented. A lot of the people supplying those products at the end recalled them as a precaution to protect consumers, but there was little information that they had that they could really rely on to ensure the status of that product. So what happened as a result of that, though, was there was significant negative press. And what you've got to realise, the suppliers, and I know that many of you do realise this as suppliers, is that if you have a competitor or a colleague that has a problem with the product, it reflects on the industry as a whole, becomes a negative effect on market. So not only do you end up getting a product recall, you end up getting this negative effect. And it drives the market down and it affects the bottom dollar. Now, Glenn talked about how allergen recalls were identified as being necessary. FSANZ has also produced some data about the causes of errors that have resulted in recalls. So they're all preventable. Every single process that leads to a product recall because of undeclared or incorrectly declared allergens is 100% preventable. And those impacts can be summarized pretty much here. I mean, I've had to sit down with parents of children that have been admitted to hospital with severe anaphylaxis, and they're just showing me photos of their child. The personal impact to individuals is significant. People that suffer from long-term, sorry, I'll take that back, people that are allergic to allergens often suffer long-term anxiety about eating foods and consuming products, and they can be very fearful of situations. So it has a long-term personal effect on individuals and their families. There's the individual costs, there's the liability of fines, and I've given you some serious examples there. The most serious one is obviously for intentional contamination, and but that is the most serious offence. But you're looking at significant offences nevertheless. The business will be named and shamed in New South Wales if they're found to have committed an offence, and there's significant media interest. So on top of all that, you then get contraction of the market. And as Glenn pointed out, some businesses can survive that, others don't. But it is 100% preventable. There are processes that you can put in place, and I'm sure Ingrid's probably going to talk about some of those processes. I know Glenn dobbed me in for talking about something, so I thought it'd be fair that I'd return the favour to Ingrid. But the all jokes aside, there is a process that you can follow, a system that has to be designed for your business, works for your particular supply situation, that is not just something that exists on paper, but that is something that is checked and verified. It does not have to be complex. I've seen businesses implement very simple systems. They then can demonstrate the systems implemented and then check that system annually or biannually, whatever's necessary for your business. If you have a system in place that is robust at addressing this risk, you have arguably a defence under Section 26 of the Food Act in New South Wales. So while you can have all these problems, you can say, well, we haven't done the wrong thing because we've taken every reasonable step to manage this risk, and this is our system. And that is the best way that I've seen for managing this type of risk. It is never something, it is 100% preventable, and you have to have systems to deal with it in order to make sure you prevent it. So I hope that's helped you understand some of the issues that we've faced. Thank you for your time this morning.
Thank you very much, Alan. So now we will be inviting Ms. Ingrid Ariel to share on her topic. So a brief introduction of Ms. Ariel. So Ingrid is the Food Safety Manager for Oceania at Nestlé and has been in the company for more than 13 years. She has a wide range of experience in food industry and food safety, quality assurance and quality management system, with strong focus in areas not limited to food safety, quality management, GMP, HACCP, allergen management, contaminant continuous improvement, and hygienic engineering design. She is also knowledgeable in TGA requirements, having worked over 10 years in a TGA licensed manufacturing facility. So let's invite Ms. Ingrid Ariel.
Yeah, hi, thank you. Just want to check if everyone can see the screen.
Yep.
Yeah, okay. So thank you for inviting me. So we hear today from both Glenn and Alan about the regulation and the impact when the allergen not being managed correctly. So what I will share is basically how we practice this allergen management in the food industry. So just for a background, yes, as part of my role, allergen management is one of the things that I look after. But this is also the allergen is one of the things that close to my heart because I have a son who has allergic to peanuts and some of the tree nuts. So it is important for me to also working in the food industry. But at the end of the day, we all are a consumer of the food, and then we just have the obligation to make sure that the food that we produce are safe for our consumer. So today I'm just going to quickly take you through in terms of the implementation of the allergen management, how we practice this in the factory. So when we look at the allergen management, the concept for me is looking at from the farm to fork. So this is how we convert raw material to finished product. So it starts from how we get our material, how we convert it in the factory environment, and then how we deliver it for our consumers so they can consume it safely. So when I look at, there are three important pillars basically to manage this one, so then we can manage it correctly as well. So people, this is our people in the factory. The regulation is important, as we understand and hear from Alan and Glenn. And then the operation, this is basically how we operate our food manufacturing. So I put here people underlying that because to me, people are important because this is where we need to develop the capability of our people to understand in terms of the regulation because this is our guiding principle on how we operate. We have people with the right capability can interpret the regulation and understand the regulation correctly, then we can deliver the safe operation to produce safe food. So this is to me, these are three key points in terms of the manufacturing. So let's look at one by one now. So when we look at the supplier, so what is involved there? So it starts with how we source of our raw material. And then also we're gonna visit about how we basically manage our supplier. And then in terms of the operation itself, there are a few things that I will share there. So from the beginning, so this is from the concept of how we develop our product, how we receive our material and release it, the storage of the material, the manufacturing activity itself, and then the end is a product release and the dispatch to our consumer. But it's not only stopping there. In terms of the consumer as well, how we engage with our consumer and communicate. So I just want to also highlight there, in terms of the product development, yes, it's happened, but this is actually where the communication and the relationship with our supplier start to be built because we need to understand in terms of the raw material that we want to use in our site. Yeah. So looking at more detail in terms of the responsible sourcing. So this is basically before we even think of purchasing the material, we need to know in terms of the supplier, our supplier, we need to know in terms of the risk review, how their understanding of the allergen management. And then also the raw material purchasing specification, one of the important document, again, as highlighted by both Glenn and Alan, compliance to regulatory requirement because every different country have a different and specific requirement. So do we understand and then does our supplier also understand the requirement before they supply us with the material? And then once we get this supplier on board, of course, it's not stopping there. It's part of our supplier quality assurance. We just have to make sure that the supplier performance being verified And then this is a continuous verification, and we need to keep this stage ongoing, because any change at the supplier, it will impact our manufacturing as well. So that's in terms of the upstream, how we deal with the supplier and the program to make sure that verification is ongoing, and then we know open the communication with the supplier, then any change in their side that may possibly impact our process, we are well aware of that. So in terms of the processing itself, so there are a few stages there: product development, material receival, how we store our raw material, the processing itself, and product release and dispatch. So if we go one by one, in terms of the new material, so this is, we talk about the stage from the product development. So from the concept until it get launched. So again, some of the things that I would like to highlight here, if we introduce the new materials, then it's important to aware of about the allergen status of the new ingredient, including the cross-contact risks. Again, highlighting the status of the supplier. Is it the new supplier or existing one? If it's a new supplier as well, this is where we need to really understand the risk rating as well. And then impact, if there is a new allergen to be introduced to our facility or line, because it's not only going to impact one particular product, but how is that going to impact the existing product that we already produce. The new formulation, so yes, product development, not only creating new product, but sometimes we also reformulate of our existing product. The ideal one, if we can provide less complexity of the allergen that is in the new formulation, that will be great, because again, if we can reduce the complexity, then means we can simplify in terms of the production scheduling. It may possibly reduce the cleaning time, and then also we can come up, what I will put there is a clean label. And then this is actually is to come up with the clean label is good as well, because we basically can increase the consumer base as well. The other thing that is important in terms of the product development is the label itself. So knowing what is the allergen status, the cross-contact risk, and the processing condition, this is one of the key that need to be taken into consideration when we develop the label. Understand the regulatory requirement, consider also the market where our product will be sold, because again, every different market, every different country have a different regulation. And as part of the traceability, label artwork approval and change over process. So this is important because we don't want to end up with the wrong label being delivered to our site. So when we move to in terms of the how we receive the material and release it, yeah. In terms of monitoring and check of incoming materials, is important to ensure that we have a practice in place to monitor whether any possible cross contact with other materials during transport. So this is part of the chains of responsibility. When the raw material come, check whether any spillage during the transport, and then what are other material that being stored there. Does material arrive on site well protected in good condition? And then if material is damaged, do we have procedure to manage the damaged and rejected materials? So that's releasing, and then that's receiving, but then also we need to check in terms of the release. So some critical materials may require a positive release. So this is the type of the material that may be or will be used in the product which carry certain claims, such as gluten-free. Or also the first delivery of new printed label. So this may have to go through the vigorous check before we can even release it, to make sure that the material that, let's say, is going to be used for the gluten-free product, it's fulfilling the requirement for the material that can be used to produce this type of product that carry this claim, as well as the new printed label. Just want to make sure that it's matched with what the change that happening there. So that's material receival and release. Then after that release of the raw material, obviously we need to store it correctly. So again, storage segregation is important because this can minimize or reduce the risk of cross-contamination during storage. It can be in the form of physical barrier. So can be all the material containing allergenic protein, for example, can be stored in the dedicated room or separate racking, either horizontally or vertically. But again, usually it's good to put it, let's say, on the lower level. So this is to avoid the risk of a spillage. So it's not going to spill to the other part of material that doesn't carry the same allergen. And then it's important as well to correct and clear labeling of allergens so then everybody know, right? This is maybe material that contain peanuts or pecan or almond, for example. The other thing that is important in terms of storage also, we need to make sure that we have a spillage handling and material return procedure or system. So this is that spillage handling is important. So then when that's happened, we know, or the, let's say, warehouse operator know what needs to be done. So it's not spreading the spillage to other material, for example. And this could be as simple as in the form of the visual standard, for example. And then the procedure for material return to warehouse. So again, not all material being used in full, for example, maybe they only have for the minor ingredient, for example, and they need to be returned to warehouse. Do we have a procedure so to make sure that what is returned being put back to the right spot? So this is again part of the traceability of the material, how we make sure that things not cross-contaminating other material. So in terms of the processing and manufacturing activity itself, so what I put there as a foundation, we need to have a robust HACCP in place because again, this is the foundation for food manufacturing. This is the risk assessment tool because HACCP will help us to determine the risks and what are the suitable control measures. So further from that, allergen risk assessment tools, these are again to support further the execution of the HACCP plan. So for example, in Australia, widely used is a vital online tool calculation, for example. So because then, yes, we know this is certain allergen that we need to manage, but then vital tool will help also in terms of for us to determine the cross contact level and everything. So these two are important. So again, HACCP is create the foundation so we know we can come up with a suitable control measure. Further than that, then allergen risk assessment tool, this is to support further the implementation and execution of the HACCP plan. Looking into the production planning and material handling, so again, use of the allergen matrix will be helpful for production scheduling or sequencing. And then consider any non-routine activity. So let's say if you have a new production trial or any longer than usual production run, what is the impact? Batching for minor ingredients. This is, I just put there, use color coding tools because again, we don't want to mix the tools because this is where the risk of the cross contact can happen. Online check, as Alan highlighted with some of the case study, it is important to ensure that the right recipe with the right ingredient and then being checked, and also we use the right packaging. Last but not least, in terms of the production, is the line clearance after product change over. There are a lot of examples where the wrong packaging being used for the wrong product, and then the allergen declaration is not correct as well. So it is important to make sure that the line clearance happen after every product change over. Rework management is also one of the things that important because we need to have a rework procedure in place. This is basically setting the boundary, what materials that can or cannot be reworked. Clear labeling of rework material. We don't want the wrong material goes into wrong product. And then it's important as well to understand where rework may be generated and where rework material will be introduced into this processing. So part of the processing manufacturing as well that is important is the cleaning program. So again, understand the process, know where the hang-up points. This is basically difficult to reach or clean area of our equipment. We need to have a clear and easy to understand cleaning procedure. Again, somebody else or production operator will execute this. Do they understand and then know what to do? We also need to validate the cleaning procedure to make sure that, all right, the procedure is robust, different people can execute it, and then we get the same outcome every time. Not only the validated cleaning procedure is important, but after that, we need to verify that cleaning program is executed correctly every time. So this can be as simple as check the product that is made after the cleaning, allergen cleaning, for example, to make sure whether or not there is any residue that's still traceable in the product. And then underlying all those, of course, the cleaning or sanitation plan is important. The last point in terms of the processing and manufacturing, what I would like to highlight as well is a preventative maintenance and hygienic design. So yes, we think about what is this got to do, but again, preventative maintenance can be source of allergen cross contact. So for example, undeclared allergen in the lubricant. So yes, we do ask our lubricant supplier in terms of do we have any allergen content. So most, for example, is there any soy content in the lubricant? And then the other important is any change management also, any change of part of equipment that can have impact on the known hang-up points. So every single change to the line, we need to understand what is the impact to the process. Can the change introduce new hang-up points? The hygienic design of premises and equipment, this is also important because again, the good hygienic design of premises and equipment can facilitate easy cleaning. Zoning, this is we have to consider people movement and also the material movement because this is one of the source of the cross contact where material move from one spot to the other spot in the factory. So last is a product release and dispatch. So this is what we want to aim that our consumer can basically consume our product safely. So again, finished product release, we need to do the check online and then also positive release for any critical parameter before we can release the product to ensure that yes, it reach consumer, they can consume it, and then we're not causing any harm to them. So that's in terms of the manufacturing. So in terms of the consumer as well, so consumer engagement and communication are important because again, we need to communicate through the correct product labeling, clear communication for our consumer when there is any formulation change, for example, or ingredient change or process change that can give impact to the allergen statement or allergen labeling. We need to make sure that we understand product profile and characteristic so then we can explain and communicate clearly with our consumer. So that's just to summarize in terms of the some of the activity that we can have in the factory in terms of managing allergen. But what I would like also to highlight, with all those in place, yes, we can prevent somebody to get hurt or sick because of the contact with the allergen. But yes, we do have a challenge as well. Then this is an ongoing challenge. So the ongoing challenge is ensuring correct information from our supplier. So this is where we need to work with our supplier to get the correct information. If we don't understand, go back to our supplier and then ask clearly, because that will help us also to manage our allergen. The second one is how we manage the change. So this is in the fast moving food manufacturing world now. Again, there are some desire of the commercial part of the business versus managing consumer risk. So this is the balance that we need to manage and then continue to manage that. The other thing is, again, fine balancing act of managing costs. So this is like production scheduling, cleaning and sanitation program, the product change over, and also equipment maintenance. So this is go back again to the reformulation of the product. If we can reduce the number of the allergenic material we use, then it will reduce the complexity, and then at the end it will help with us to managing our costs. And last but not least is actually continuous education and training. This is really important because we want to make sure that we are aware of any regulation change, and then we are also capable of executing the allergen management program in our site. So that's the overview of it. Thank you, everyone, and happy to take questions later.
Thank you very much, Ingrid. So next we'll invite Ms. Yonghui Liao to share on the solutions and recent developments of food allergen testing. So let me introduce to you Ms. Yonghui Liao. She has over 11 years of professional experience in food safety, and she holds an MBA from the California State University in East Bay, USA, and has received a certificate of attendance from Cornell University Food Science Dairy Training Program in 2013. She is also active in conducting mycotoxins, food pathogens, and allergen workshops in Asia. Yonghui is currently the Managing Director for Roma Labs Asia Pacific. So Yonghui, please.
Yes. Good afternoon, everybody. Hope you can see my screen.
Yeah, we see it perfectly.
Okay. So I would like to cover a couple of case studies. Roma team out in Asia have been supporting the customers in the region. So today I'll cover a little bit from supplier support that maybe we should also know from crop rotations, risk management for food allergen. And also we'll show an example for peanut allergen in terms of peanut free in confectionery. What are the cross-contact risks that we're looking at supporting the customers in the region? Infant formula is a very critical part of the industry that we supported, especially for casein allergen testing, which I want to show everybody the proper technique of doing a validation. And on top of that, the current industry trend is going towards dairy-free. So there is an operational LOD in the industry. Many manufacturers are actually moving on into this principle, and I hope to share what does it mean from operational LOD perspective in food allergen management. Last but not least, we have done some publication in IFP this year, so we hope to share them as well, our posters publication with the entire team here this afternoon. Without further ado, everybody may be aware of crop rotation. So how does crop rotation affect food allergen risk management? A very popular current challenges that we're seeing on and off throughout the year will be the garlic harvesting. When you harvest the garlic, sometimes you may find peanut allergen, and I wish to show you the case study here. So in a flavoring company in Asia, they sorted our help from Roma Singapore to actually understand why is that the end user customers are complaining of a peanut allergen presence in the garlic material that they are supplying because they are a flavor company. And when they check the certificate of conformance or assurance from the supplier, it indicated that peanut allergen is not detectable. So where is the story? And it begins from here. We received a sample from a flavor house, and the result done in the flavor house with our allergen aquaquan peanut kit, we have a 32 to 34 ppm detection after the end user make a complaint to the flavor house. And in this case, the entire batch was rejected because they can't actually use this with a peanut allergen found in the garlic material. And with this, the flavor house, of course, feedback to the supplier, and this supplier also engaged another study done by a third party, producing a result that is a 1 ppm level. In this case, this kit or this third party shows that it's not present. But that's not true because already the end user are complaining. So how did Roma come in to help is that we actually use our knowledge and our matrices information. We did a test locally in-house with our kit again. We also deploy our sister facility, which we have another laboratory in Europe, which also have ISO 17025 certification. And they also did a result using another company kits, company B's kit. And the result kind of quite similar to ours. So there goes, there is a very important part of the story here is that with the allergen kits, diagnostic kit, manufacturing kit that we supported in the region, we also provide the service to ensure our results are verified properly to help the industry and to help our customers to be successful. So in summary, right, the outcome will be our kit, Algonquin peanut and ELISA kit is actually usable and validated fit for use for batches of garlic powder received from their supplier from that day onwards. So they have assurance from us the kit is working really well. And we are able to support them whenever there's emergency to do a parallel test to make sure the continuous verification of our supplier support. And we also build up in Roma, Singapore, a matrix data bank that we can support our team and our customers globally or technically to ensure when materials come from different regions, there is a diagnostic kit available from Roma Labs that could support them. And just a very quick update on this allergen risk in crop rotation. We have winter crop, we have summer crop. And many of this crop actually is grown in the field where the farming are happening. When we actually engage supplier to support us or supply us in bulk, food manufacturer will be encouraged to actually implement a questionnaire because you need to know the source that is coming from and how potentially the farmers are rotating the crop that may affect the food allergen risk that comes along with the garlic, for example. Here, particularly this case, the supplier is actually from China. It also takes a lot of education because they need to know that when they are growing crop with the garlic rotating with peanut and peanut back to garlic, it comes along with the garlic itself. You cannot clean them out. And this is a risk factor. So education is very important to the supplier and the supplier to the farmer as well. So we would encourage everybody to make sure that when you have a supplier change or you have an old supplier, very important you know the source of the garlic, for example, in this case. So in the region, we also encounter chili also could be contaminated with peanut, also because of crop rotation. Yeah. So this is pretty important to take note. I hope to share the case with everybody here. And next, I would like to also share from cross-contact contamination. Earlier, Ingrid talked a lot about cross-contact contamination. So we would like to share a confectionery company in this case study, how they manage the risk for peanut allergen within the background of their production. So a very large multinational confectionery approached Roma team, and they wanted to have a very good established data bank to actually understand the cross-contact contamination within their facility because they wanted to make an allergen-free claim for peanuts. So in this case, they already informed us their current ELISA kit is actually going to be discontinued by the manufacturer. But they have a very stringent validation procedure, which they engage our help because we can do a very quick turnaround from Roma team. And they actually asked for us as a kit supplier to provide full, transparent, complete results in communication with them. And we started and embarked on this particular analysis. Here is a very typical testing criteria that if you engage a diagnostic kit company to help you in the journey. So testing criteria could include method must be test for peanut protein. So in this case, it's a peanut protein. And the final result must be established or expressed in peanut. Matrices could be ice cream, chocolate, and chocolate bar. And the minimum size amount based on their knowledge in this industry is 2 grams. And we have to spike them at 1 ppm, 5 ppm, and 15 ppm. So this is established in the beginning of this journey. And the range of the peanut quantification could be 1 to 15 ppm. Recovery range following the AOAC recommendation between 60 to 130. And there's a very important part about reproducibility at 95% confidence level. So you have to have a very ease of use, good for operator to execute them with reproducibility at least below 40%. And the data must show linearity, and we have a limit of detection and quantification established. And in this case, they actually have a very stringent criteria. Precision analysis involved 2 operators randomly selected over 8 days. So they want to make sure that it is easy to execute and repeatable and precision-wise is very good between these two operators. And of course, the solution must be linear. And we embark on a journey. Our solution in this journey shows that when we use Aquaquan plus peanut kit, we actually are able to support their stringent requirement. And with this, the customer become very open, and we continuously right now supporting them in multiple recipes to establish this validation quickly for them. And we've been successful in this journey. So what is the actual outcome from this study? Roma is able to satisfy and meet the validation criteria. And we established this very clear study from the beginning with the performance criteria. And this particular peanut kit plus kit has been successfully beta tested in 3 manufacturing plants across 3 different continents and culture, and it is able to be deployed easily. And today we are adopted as a key detection kit, key peanut kit for food allergen testing in their choice for the worldwide implementation. On top of that, we also want to share a little bit of casein, because right now for baby formula is hugely very important for the infant baby. And how do we help our industry or customers in this case? A very large multinational company approached us in this region, and they needed to check whether the casein residue is found after the hydrolyzation happened in the baby formula, which is whey-based. And this is a very challenging formula because baby formula come with very high complex matrices because it has fat content as well. And the company has tested many types of kit, and they discovered that sometimes low recoveries happen with spike casein. And we discussed with the customers and found out that maybe our solutions to provide will be our casein plus Aquaquan kit. And this kit could be able to help customers to understand whether there's a fully or partially hydrolyzed formula casein contamination left over or not. And we also add a known amount of casein in the form of skim milk powder as defined by the customers, in this case, to do the formula check for this recipe. And we decided from the beginning of this journey, a low level and a high level in the middle of the calibration curve could be a good indication for us to test whether the kit, our Aquaquan Plus kit is able to catch the casein residue. And this is our results here. We have a casein ppm and also as a recovery. Both columns are indicated here for Formula 1, Formula 2, and Formula 3. And we also did a blank, which is with no spike and no matrix for the baseline study. And through this, we're able to summarize that the recoveries of high spike were much better than the manufacturer's expectation. So the kit is actually very friendly, easy to pick up the residue. And currently, the data are being reviewed by this infant formula manufacturer. We look forward to continue to the journey to assess the rest of the range of the infant formula as they are producing different recipes within the same production line. And coming to this particular very important, earlier I mentioned in the agenda for operational LOD. So what is a trend in the market is that food manufacturers are moving into the operational LOD because of the demand of the market if you're looking for dairy-free recipe. So in this case, a very important MNC manufacturer in various FMCG product, ice cream, snacks, confectionery, and personal care is their main product line. And they has global obligation to make sure regulation they are able to comply, especially in LOD for all dairy-free bars. In this case, it's ice cream bars, as well as ice cream tubs locally in Australia. These particular LOD studies have to be done on each individual type and flavors by the manufacturer's requirement. And the samples are also sent to Singapore for us to test in our accredited ISO 17025 laboratory. We did use our most sensitive kit in ELISA testing in total milk in the market. So we used our kit, and the test results are also shared with the customers. And I'll show a little bit on the entire operational LOD determination, how we actually do it. And having determined the LOD for each individual product, operational LOD for each individual product and recipe, now we have a monitoring phase. Because you have done the baseline, you're able to see when there's an exceeding of this limit, corrective action can be done immediately. So operational LOD really proved to be a very great tool for risk mitigation, and it is currently the increasing trend in the market. the industries are going after this capability. So how does it work is that an operational LOD is established for each of the recipe that you want. In terms of ice cream bar, for example, we'll receive first recipe, 1, 2, 3, 3 rounds. So they wanted to make sure at each production cycle, they have a baseline study of the operational LOD for the total milk, because they wanted to claim dairy-free for the ice cream bar. So in this case, we determine our results here from our reading 0.06, 0.13, and 0.06. And recipe 2 was sent 1 round as well. And with that, Roma calculated the LOD operational for them is at 0.06 ppm, expressed in milk protein level. So this will be the baseline that they engage with their supplier, with their operations, with their QC team. And with this, if there's any high level above this limit, they would trigger a corrective action check, whether there's still a challenge or not that they haven't overcome. And in terms of ice cream tub, operational LD is slightly higher. So because of this, this particular manufacturer are reviewing to see whether there is implication or not to the entire production. So we're working closely with them right now. Okay, so the outcome is that we need to help our customers to understand the importance of possessing operational LOD for food allergen risk mitigation. This is a very important part as a diagnostic kit manufacturer here, that we need to continue this journey to make our customers successful. And we have to help them to set this threshold value that will trigger any action if the LOD is actually found in terms of their action taken could be even lower. That will actually help them to do a risk mitigation strategy for the long-term success of the brand. Next, importance of having an extension, because oftentimes you have a speed requirement to get the result. But at the same time, you hope to have a very good report from an extension of a third party. And Roma actually have this laboratory capability with ISO 17025 accreditation to help our customers in this LOD study. So we hope this sharing could be helpful for everybody here when we do dairy-free claim. And similarly for gluten-free claim, it could be also execute the same manner. Conclusion is that food allergen is a very diverse, extremely diverse, and limited also because of the industry in certified reference material for allergen. This has been a challenge. So there's no common reference point. So it's good to have a technically very strong, capable team from the diagnostic kit manufacturer to help you in this journey. Very important is training and close collaboration. It's very necessary between us and customer. And we hope Roma can be in this journey for every customers of ours to make this world a better, much better place, especially for food allergen risk mitigation. The method must be suitable. So we are in this journey to make sure our method is suitable for every of our customers. And we can actually work with customers to customize and make sure that you have a very good LOD to actually go after your risk mitigation. So we hope these 4 very important case study could help everybody here. Next, I would like to share on the IFP publication this year that Roma has shared in the US. And first publication will be very interesting because in Asian food culture, we eat a lot of spices. We also have a lot of sorcery and ingredients that come into play. And majority of the concern is whether there's actually a fish allergen being found cross-contact within this particular product or not. So we actually did a kimchi study and we found very little fish sauce in the fermentation process. But we also found that actually there's also crustacea found in sambal chili paste or sambal shrimp paste, very popular in Southeast Asia. So we found that our fish kit actually when we test has no cross-reactivity with crustacea because it's a shrimp base. So in this case, the kit is actually fit for purpose and application ready. The other study that we did is on the ELISA-based method for our milk kit in chocolate matrices. As everybody know, dark chocolate sometimes are produced already with the same production floor, and it could come from dark chocolate already contaminated with milk. Although it's supposed to be not happening because of the same machine tool, there is a risk. So we actually did a study in a supermarket in Singapore to collect chocolate samples from the market, and we did a study to check whether the labels is true per their claim. And through this journey, we found out our milk kit is able to pick up according to the labeling. So this is a very good study. I hope everybody could enjoy. We'll send this study after this particular webinar. Last but not least is our third posters that we publish, because a lot of customers ask us for CIP rinses and environmental surfaces, what are the correct swabbing procedure and the correct swabbing kit to actually do a very good allergen risk mitigation. In this study, we found out that our Aquaquan allergen swabbing kit is very versatile. It works with our fish allergen kit, and we're able to pick up a very little residue at the limit of detection. So this is a really good kit and a very good swabbing kit for our industry and customer base. And I hope that is the last presentation slide I have. Thank you very much for joining us today. Really appreciate your presence, and I'm looking forward to the questions that you may have for Roma team. Thank you.
Yep, thank you very much, Yongwee. So now we have concluded all the presentations, and we'll move into the Q&A session. So we already have some questions. Just a minute. We already have some questions from the floor. So let us move to the first question. Okay, so the first question is actually from Ms. Eleanor. So how will FSANS or MPI actually police the changes in 2024 to ensure companies have complied? So Ellen, would you mind to take this question?
Yep, very happy to answer that question. There's a couple of strategies. There's actually a national working group, the Implementation Subcommittee on Food Regulation. And what they usually get together and do is design targeted projects that will ensure compliance. And on top of that, different regulators do testing. I know that some states have required to do regular testing for allergens. And not that I'm letting anything out of the bag, but I'm actually working on developing a project to test allergens in New South Wales. So we go out, we just buy things in the marketplace and we get it tested. And we look at the labels and we follow up on that. Of course, one of the other things you've got to remember is that a lot of stuff does get picked up by people having an allergic reaction, and non-compliance is usually that is tested by the consumer themselves, and that is not a test you want to fail. So there's a lot of strategies in place. There's also a time frame to comply. So as Glenn said, there's 3 years to implement it, and even after you've implemented it, there's a further time period to allow old packaging that's already in the marketplace, I think for a further 2 years, correct me if I'm wrong, Glenn, old packaging already in the marketplace to push through. So it is a very gentle approach. I've shared some data, some links, including the AFGC guideline on allergen on labelling, but includes a really good section on allergens. There's also expert consultants in allergens. The Australian Institute of Food Science Technologists is one of them. That's a good group to contact. I'm sure there's others around the world. I'm just talking about the ones that I know well. So there's a lot of good people that can help with that, but there'll definitely be compliance projects targeted ensuring that this gets picked up.
Thank you very much, Ellen. I hope that answers your question, Ms. Eleanor. So we'll move on to the next question. There's a question from Jody Watt, and he asked, is there much variation between countries for other free claims other than milk when exporting goods, for example, gluten-free and etc.? So Ellen, would you mind taking this question as well?
Probably work with Glenn on this because I'm not across other countries. I know that there are standards. So the standard in Australia that talks about free claims is standard 1.2.7, which talks about what levels are permitted to say something is allergen free. Remember that there are some, and that would be below the limit of detection in, I think, all cases. So that limit of detection test is important. There's something else that I suppose that needs to be considered, is that if you have a product that says dairy free on the front of a pack, you can't then say on the back of the pack may contain traces of dairy or may contain dairy. And I do not like the word traces, because a trace does not really mean anything in terms of quantity. And we have had investigations where people have had severe allergic reactions where that statement's been on a label. So systems that Ingrid pointed out are very important to put in place. And the really well-established system, as I said, is a defence to any issue. And I think the only system I'm aware of is the Vital system in Australia that's developed by industry. There are probably others. And if we were to investigate, we'd look at those systems and how they're implemented. I hope that's answered your question. For the Australian side, I don't know about overseas. Glenn, do you have anything to add about that?
That's a good answer, Alan. Actually, I think you covered it quite nicely. Just a reminder, though, that with claims that food regulation overlaps with consumer legislation, I mentioned the ACCC and the New Zealand Commerce Commission, who take a very strict view when it comes to free claims. They interpret free as being zero. And so, as Alan says, if you are making any such free claims, then certainly being below the limit of detection is important. There is one exception to around some of these threshold issues, and that is with certain products and gluten. There are some exemptions for certain substances, such as glucose syrups, where consumer organisations and indeed the Food Standards Code for some of these substances requires gluten to be below 20 parts per million only. So there is some tolerance in the case of gluten. I hope that's helpful.
Thank you. So we'll move on to the next question. There's a question by Hui that asks about the regulatory threshold. So, dear sir, I only found the regulatory threshold declared free form in the product for gluten, but for other allergens like soya, peanut, I did not manage to find the MRL threshold or the declared free threshold. Glenn, could you give an insight to this question?
Yeah, I think Alan covered that quite nicely. In standard 1.2.7, there are a list of thresholds, and I know that that globally the science is starting to align around this issue of thresholds and what level is generally considered to be safe versus what is not. And I think that science really can't come soon enough in terms of that consensus. And I note that the WHO/FAO expert working group that I mentioned in my presentation is now moving to provide us with some updated global guidance on these thresholds. Once that threshold information is accepted, hopefully it will be uploaded into that review of the Codex standard, and that will provide some solid answers to these types of questions. But at the moment, unfortunately, we're at the mercy of the sensitivity of various test methods and indeed the commerce type consumer laws in both countries and indeed around the world.
Thank you, Glenn. And while we still have you here, Ms. Noor Suryati Ahmad also asked, why is there a different allergen requirement for each country?
That's a very good question. That expert working group has come up with a standard set of global priority allergens, and this is an attempt through that Codex process to standardise requirements. And so some standardisation will occur in coming years. It's increasingly important with a globalised food supply. But in terms of regional or national differences, Each country performs its own assessment as to which of the potentially up to 2,000 food allergens that are present are clinically significant. And what is deemed to be clinically significant in certain countries and regions can vary based on two key facts. Firstly, the incidence of the allergic condition in any given population. So certain regions we know, for example, Australia, New Zealand, there's more consumers who are susceptible to milk and dairy product allergy, whereas we know that that is not the case, in particular as you move further north into North Asia. So that's the first key difference, is population sensitivities or incidence of the food allergy condition. The second issue is around regional or national differences in terms of food consumption. And so, for example, in Australia and New Zealand, about 5 years ago, we mandated the declaration of lupin as a mandatory allergen, and that's because we got a sense that in Australia and New Zealand, there's going to be particularly in Australia, there's going to be an increasing supply of lupin as an alternate to flour, as a grain, as a base for making carbohydrate products. So that sort of illustrates the difference that can exist regionally or nationally with types of foods being consumed, and that's the second major source of differences at the national or global regional level.
Thank you very much, Glenn. And to Yongwei, we still have two questions from Ms. Noor Suryati. She has a question on my raw material is soya sauce, and our supplier declared it contains soy allergen, and the high treatment process have caused the allergen protein to denature. How do we conduct the allergen validation since the allergen protein has already denatured?
So similarly to just now, the infant formula casein studies are done. So sometimes the processing of heat may not denature everything. So it's important to check the process stability to ensure that you don't have a soy allergen left behind. So this is a very classic example of validation of a kit to actually trace that amount and have an understanding whether it's fit for use or not application. So we will recommend that you have the raw material, at least 3 batches, and if possible, you can send to Roma Labs. You can actually do the spike and help you see whether the recovery is good. So there'll be a LOD that we can actually detect for you. So this will be a very good study that we can support you, customer. Hopefully we can help you.
Yeah, and she has another question on, she was asking, my supplier for raw material declared that their products contain gluten. However, upon checking by ELISA and PCR, no gluten allergen has been detected. So how do they conduct the allergen validation?
Yes, in my first case study, I talked about the crop rotation, So actually, there's an inherent problem of homogeneity when you send the sample. So for a detection of using one little sample to actually confirm that the product actually does not or does have gluten, so maybe a better study is to have a total understanding in terms of doing this allergen validation. So we will recommend at least you have 3 batches of this raw material. And according to the certificate of assurance from the supplier, each batches we should see the result, what it means by containing gluten at which level. And we can actually do the studies in our laboratory in Roma Labs to help you. So we look forward to you sending us a sample. We can definitely solve this problem for you.
Thank you. And then we have another question from Ms. Pui Yi Yong. May I know, is it compulsory to have physical segregation, for example, a wall or a separate room to carry out allergen and non-allergen processing? I think this would be a question for Ingrid.
Yep, so thank you. So short answer is no. So go back again to managing the allergens. Basically, we manage the risks. So the best way, the best defense to this is how we manage in terms of the batching of the material, how we control the processing environment so it's not cross contact to the other production that don't have allergen. For example, like I shared before, is as simple as the production scheduling. So you can start with the non-allergen production first and then moving to the more complex product that contain more allergen. That's just for one of the examples. So that's hopefully that's answered the question.
Thanks, Ingrid. And there's another question on the allergens that may be found in lubricants. So, Glenn, would you mind?
Sure, yeah, no problem. So yeah, there are some allergens in lubricants. Lubricants, like many other types of substances, are typically regarded as what we call processing aids. And there is a general requirement, well, processing aids are exempt from labeling unless there's an allergen present in that processing aid, and there is a possibility that that processing aid or the protein from that processing aid is present in the final food. So I hope that helps, but really it's up to food businesses to make an assessment as to whether or not it is likely or possible if that processing aid appears in the final food. If it does, my suggestion is that you label it accordingly and be cautious in this regard.
Thanks, Glenn. And there is another question on casein as an allergen. Can it cause the same sort of reaction? This question is by Angeline. So, Glenn?
Yeah, sure. So casein is one of the two key proteins in milk and dairy products. The other, of course, is whey protein. So it's the protein elements of foods that cause the allergic reaction at the clinical level. And so casein itself may be the allergenic component from milk, but we for the purposes of regulating and labeling, we refer to milk as the common name, and we would want to see any dairy containing ingredients or food additives bolded in that ingredient list as per the new requirements. So hopefully that helps there.
Thanks, Glenn. And because of the time, we will take the last question. This is the question by Jasmine. So she is asking you, Ellen or Glenn, what are your thoughts on the imported food program reviewing and including allergens as a high risk, requiring surveillance of certain commodities coming into Australia, New Zealand, similar to coconut products, but looking more broadly?
Okay, I'm happy to answer that one. So just clarify the question because it was a long one. So we're talking about surveillance coming into Australia of products, of allergen declarations. That there's a program run by the Department of Agriculture, Water and Environment, where they actually actively monitor labels and ingredients, and they generally test a certain percentage of product. Sometimes they will do allergen testing as a targeted product. It depends. Sometimes that testing is left to the state regulators to do, but then if there is a problem with the producer or a particular site, then Department of Agriculture, Water and Environment will put a holding order for foods coming in from that site and prevent those coming in until that supplier has verified that they've taken steps to address that risk. So there's a number of, it's really a cooperative effort. Like when we talk about Glenn and I at one end and me at the other, we've got all these other people in the middle, and they all talk very actively, they share data, and they work at different levels to sort these things out.
Thank you very much, Ellen. So I guess we would have to end the session because we are way past the time. However, for unanswered questions, not to worry. We will be sending all attendees a follow-up email with a link to the recording, as well as to download all the documents that we have mentioned today in the session, and also a document to answer the questions that you might have raised while you register or it has not been answered in today's session. So please look out for the email and yeah, feel free to have a look at all the documents and the recording that has been sent to you. And we hope you have enjoyed today's session, and we look forward to having you in our future sessions on different topics. Thank you very much for your time and have a great day.
Thank you. Thank you,
Thank you.
everybody.
Thank you. Bye.
Safe, take care. Bye-bye.